Staying fit is an important part of growing old gracefully, but anyone with joint problems knows sometimes it's tough enough just to do the daily chores, let alone an exercise routine. Dr. John Radnoff, the medical director at Florida Hospital Waterman's Joint Replacement Center, says that when the pain is keeping you from living a full life, you may want to think about surgery.
There's nothing worse than not being able to be active. When it gets to the point where somebody cannot go down to the end of their driveway to pick up the mail, or they even can't get from their bedroom to the kitchen, let alone go out and exercise, go to the movie, take that trip. When it gets to that point, that their activities has been so much decreased, their lifestyle has been altered so much, they really need to consider having some kind of joint replacement to get that fixed. If their lifestyle is being altered to that degree, what typically happens is they become less and less active. As they become less and less active, of course, they're sitting and riding instead of walking, standing. The rest of their body gets in worse shape, not just the rest of their joints and their musculoskeletal system, but their cardiovascular system, everything starts to get worse. As they get more and more out of shape, they're doing less and less still, so it becomes a catch-22. And then, of course, the emotional part comes in. They start getting down in the dumps, they start getting bummed out, they start getting depressed, their spouse starts getting depressed, you know, because the spouse is going to do things and they're sitting here and they can't do things, so it just becomes a very bad downward spiral, physically and emotionally. Joint replacements, you know, they've evolved quite a bit, even pain control. You know, 20 years ago, 25 years ago, when I really started doing this stuff, you know, it was really, patients had to just suck it up. You know, with that, after that, the first day or two after that knee or hip replacement, it was tough. But just the pain control methods we use nowadays are phenomenal compared to what they were even 5 years ago. Now with our knee replacements, partial knee replacements, we do these femoral nerve catheters where the anesthesiologist puts this little catheter over the big nerve that goes into their thigh that supplies pain to their knee, and we're able to quite often completely eliminate the pain, the post-op pain, those first 48 hours. The way we're able to use some of the different medications now, both injectable medications, oral medications, the machines, the self-medicating pain machines, we're able to keep that pain a heck of a lot better under control now than we did, like I said, 5–10 years ago. And so it's a much less painful procedure.
You'll find contact information for Florida Hospital Waterman's Joint Replacement Center when you click the Active Again story icon at yourhometownhealth.com.